take a moment and appreciate what the day is. It's Friday the 13th, Amma.
Yes, it is Friday the 13th. Many people can be superstitious, and I pointed out that our prompter, which, has what we read, tanked, and I wonder if that has to do with Friday the 13th. But we are joined by Dr. Richard Bermudes, a psychiatrist with Mindful Health Solutions. Okay, a lot of people have phobias. Let's talk about some of the, we say stranger ones, but not strange for the people who have them. Like, there are actually people who are afraid of paper.
Yeah. What we're finding in medical science is that the brain can really develop a phobia to almost any object or situation. And most people with phobias actually think these are irrational, just as irrational as we think they are. Mm-hmm. So that's what we're finding out. It's not that the phobias are increasing, it's just that we're finding that these can develop to almost any object or situation.
Now, I have a great fear of spiders. Can I assume that I had some bad experience with it, or does it just develop over time, nothing really triggers it?
Well, there's certain phobias that we're almost all pre-programmed to have. So many of us have a fear of rodents, mm-hmm. snakes, spiders. These are very common. Now, fortunately, you don't hang out with spiders, right?
Let's hope not.
Yeah.
So, no, could it be a social thing as well? You're kind of brought up to think you shouldn't like these things?
Certainly, there's some conditioning that can involve, but particularly with spiders, that's one that we're pretty programmed to have. So,
how do you know if it's gone beyond the normal realm of being afraid of something? How do you know when it's time to seek help?
Okay. Well, there's two things. One is the fear is pretty irrational, and the person with the phobia knows that. The second thing is it's a very intense anxiety response. So someone without a phobia will have an anxiety response. When that object of fear leaves, that anxiety response actually goes down. When you have a phobia, it goes on, and it's magnetized for 10 or 12 times the normal. So it's actually a more intense fear and more irrational. And it affects our lives when we have a phobia. We can't go to work, we can't go to school. So it impinges on multiple facets.
Now, can you be helped? A lot of people will say, just face the fear, just do it, you'll get over it. Not true? True?
Well, there's some truth to it, actually. The most evidence-based therapy is called an exposure therapy. It's a branch of cognitive behavior therapy. So there is help. And the treatment is very effective. In some studies, 75% of people will actually get over their phobias with this type of treatment.
Well, that is fantastic. Good to hear. Well, Dr. Bermudes, thanks for coming in on this Friday the 13th and shedding a little light on it.
Bermuda on Friday the 13th. Bermuda Triangle.
Oh, hey, good point, Paul. He's pointing it out.
Thanks, Doctor. Thanks. Coming up, you've probably seen her commercials on TV, and it looks like you may not see them anymore. A local tax attorney has found herself in hot water, might face jail time. That story's ahead in just 8 minutes. Sean.